September is Prostate Cancer Awareness Month, and according to the American Cancer Society, the disease sees over 300,000 new cases yearly, as well as more than 35,000 deaths a year, making it crucial for men to undergo a prostate exam. And joining us today is Gary Dumas, who is a prostate awareness advocate. Your mission is to help spread awareness to men that may be ignoring some early signs of issues with the prostate, could be prostate cancer, and all of this is based on an experience you had, right, Gary?
Absolutely. And you know, usually people say we got to stop meeting like this, but I want to say no, let's keep meeting like this because we're helping people.
You're helping people talk about it, and especially this is something that affects men, and sometimes it's hard for men to talk about things. So you ended up having to have surgery on your prostate. Tell us about that and what the warning signs were for that.
Yeah, it was absolutely brutal. In fact, some of the signs that I had experienced, although I had no idea it was prostate issues.
And what were some of those signs?
As far as frequent urination, and then at some point you just got to where you couldn't at all.
Right.
And that's when I knew it was a problem. So I had to go to emergency, probably 2 or 3 trips to emergency actually, and it was certainly something. And I believe that a lot of that would have been prevented had I gone to get medical counsel like early on. Right. Even if it was just a random checkup, I should have got on it early.
So your prostate was swollen to the size
of a grapefruit.
Oh, that just sounds painful. And so you had to have surgery. You didn't have to have it removed. You didn't have surgery, but you avoided cancer because you did go in.
Right. And I was just a few stages away. And one of the things I asked the doctor was, doctor, what could I have done to not get into this situation?
Right. How do we not get here?
He said nothing. Absolutely. He said there's nothing you could have done that has put you in this situation. It's just something that happens. There's a high risk for men over 55 and then up. So
some of the symptoms of prostate problems include urinary symptoms, including frequent urination, especially at night, difficulty starting or stopping urination, weak or dribbling urine stream, and or pain or burning during urination. And so you did see some of those issues.
I did. I experienced all but the blood in the urine. So I'm grateful for that.
You were just one step away.
One step away.
You get there and it's a whole different story.
It's a whole different situation. Although there are a lot of cancer survivors, which we're grateful for, but it's just an excruciating and extremely traumatizing encounter during that process.
Okay, so explain to me, so why was it so traumatizing?
Well, more so emotional more than anything. You know, men feel like at times we're invincible, and not out of just being arrogant, but we're men. We just believe that we can handle anything, but the reality is we can't, especially when it comes to those emotions. We have like no control over those at times. And regardless of how strong you are physically, there's always something that can affect you emotionally. Yeah,
and I think that's really, you know, the difference. You know, women, we're used to going to the doctor to get annual checkups with an OB, and if you have children, I mean, it's just a whole host of things. So I think,
which, by the way, women are some of the like strongest creation ever, in my opinion.
Well, and I think we're used to having to get a mammogram and get an annual, you know, exam and all the different things. And so, and I just realized as you're saying this, men don't really have to do all that. So that would be traumatic if you're not used to having to get something checked all the time.
Absolutely. And one of the things, I speak from an emotional perspective, that helped me to get through it was just being compliant, doing everything that the doctor advised me to do, sticking to the regimen, the follow-ups, and amongst other things, but that was the most important thing. And I say that because it sounds simple, but that can be the greatest challenge. Men, once again, I'm okay, I got this will be all right. Well, it may appear that way on the front end, but on the back end, it could be a whole different situation.
And I want to just show again some of the other symptoms that may include pain in the lower back, pelvis, or the groin area, painful ejaculation, erectile dysfunction, fatigue, and weight loss. All of those could possibly be signs. And there's not necessarily an age thing either, so it's really just something that all men need to kind of be aware of, right,
Absolutely.
Gary? Yeah.
Absolutely.
Especially if you're over 50 or over 55.
Especially if you're over 50.
But it could happen in your 20s. We know people that's happened to. So.
Yes, it has.
Gary Dumas, thank you so much for being brave and open and sharing all of this, because hopefully we'll save one man's life.
And all it takes is one. Men, get checked out.
All right.
And thank you as well.
Thank you.